Ever feel like you're just swimming in information? You know, you want to get a handle on something complex, but you just wish someone would just cut to the chase, explain the important stuff so it actually makes sense.
Yeah, absolutely.
Well, that's what we do here. Welcome to the deep dive. Today, we're tackling something that, well, it seems to trip a lot of people up. What is the actual difference between dry needling and acupuncture?
It's a really common question, and you're right, they both use needles, so it's easy to see why people might think they're, basically the same thing.
Mm-hmm.
But as we'll get into, the thinking behind them is quite different.
Okay, so to help us sort this out, we've got some interesting material. It's excerpts from an article called Differentiating Dry Needling from Acupuncture on the Jungian Tai Chi website.
Right.
And our mission today is pretty clear. Based on what this source says, we want to really pin down what makes these two techniques different.
And what's interesting about this source is how upfront it is. It basically says right away, hey, these might look similar, but they're not the same practice.
Exactly. My first thought, honestly, and I think a lot of people feel this way, is that dry needling is just, well, acupuncture rebranded for the West. You know, You see the needles, you hear pain relief. It seems like an easy connection to make. But this source really pushes back on that idea.
Yeah, it does. And that's really the core argument we're looking at today. The source argues that even if the needles sometimes go into spots near traditional acupuncture points, the whole reason for doing it, the assessment, the technique,
Yeah.
it's coming from a different place entirely.
Okay, so let's unpack dry needling first, according to this source. It really hammers home the Western anatomical basis, doesn't it?
Totally. It's all about muscles, where they attach, what they do, the nerves that make them work, and these things called trigger points. Those knots that can cause pain, even in like a totally different part of the body.
Right, referred pain.
Exactly. And the source even points to a specific book, Trigger Point Dry Needling by Dahmer Holt and Fernandez de las Peñas, which kind of signals, this is grounded in modern anatomy and physiology. It's based on our current understanding of the musculoskeletal system.
And the actual technique sounds quite distinct, too. The source talks about feeling for those tight spots in the muscle.
It's palpation, right?
Right, palpation. Finding those tight bands or nodules.
And then inserting the needle in a specific way that it says is not how you typically do acupuncture.
Yeah, the focus is really on that myofascial trigger point within the muscle tissue. Think of it like a tiny cramp or knot.
Okay.
The needling aims to release that specific knot, often trying to get like a little twitch response from the muscle.
Okay. No, it is interesting. The source does mention a link to Chinese medicine's idea of muscle sinew regions. So it's not like completely separate worlds.
That's a good point. It suggests maybe both systems are observing something real in the body's soft tissues, but the interpretation of what's going on and the methods used, they come from very different rule books, basically. One's Western anatomy, the other is focused on things like meridians and qi flow. Okay, let's get specific then. The muscle examples seem key here, starting with the head, neck, face. The corrugator supercilii, the frowning muscle.
Yep, that's the one. The source says its trigger point is often near an acupoint called yuyao, or fish waist.
Okay.
And for treating, say, a frontal headache with dry needling, the description is very specific. Pinch the skin, insert the needle pointing downwards towards the eye, but shallow, just into the muscle belly.
So it's targeting that specific bit of muscle tissue. The acupoint is nearby, but the target is the muscle based on its anatomy.
Precisely. It's not about the energetic properties of yuyao. It's about releasing that contracted muscle fiber.
Then there's the psoas wrinkles, the nose bridge.
Right. Near the yin-tang acupoint, seal hall involves the facial nerve. And again, for a frontal headache, the technique is described similarly. Pinch, perpendicular insertion downwards towards the nose, into the muscle. There's even a YouTube short linked.
These details really paint a picture of like a very hands-on anatomical approach. You feel the muscle, know what it does, needle that muscle.
Exactly. It's driven by that anatomical knowledge.
Okay, moving to the jaw. The masseter muscle, big chewing muscle, trigeminal nerve involved.
Yep, near the ST7 acupoint, Shagwan or lower hinge.
And the needling.
Straight into the muscle belly, perpendicular. Again, the focus is on the muscle's function closing the mouth and its nerve supply, guiding the practitioner. The acupoint's location is noted, but it's not the primary driver for treatment.
Got it. Temporalis muscle next, also closes the mouth. Trigeminal nerve again. Trigger points near GB3 and GB7.
Right. And for a temporal headache, the needle goes perpendicularly towards the temporalis fossa.
And there's a warning here.
Yes, a crucial one, caution about the temporal artery.
Good.
That's a prime example of the Western medical underpinning. Knowing the anatomy to avoid hitting major blood vessels, that's standard anatomical safety.
Makes sense. Zygomatic muscle, the smiling one.
Facial nerve near SI18 Quan Liao, cheek seam.
And the needling.
Can be slanted or perpendicular, suggests a bit of flexibility based on how best to reach the target muscle fibers.
Okay. Medial pterygoid, another chewing muscle, near ST6, Jiash.
Yep. Needle goes perpendicular into the muscle belly right at the angle of the jaw. Video linked for that one too.
Seems like these jaw muscles are common targets.
They often are, yeah. Big source of TMJ, pain and headaches for many people.
Then the lateral pterygoid. TMJ joint involvement near ST7 again.
Right. For this one, the patient needs to open their mouth.
Oh, interesting. Why?
It changes the muscle's position, makes it easier to access. The needle goes into the muscle belly, aimed towards the molar root. It's a biomechanical consideration.
Gotcha. And last one for this area, the digastric. Under the chin.
Yep, facial nerve near Ren 23 acupoint. Needle goes perpendicular towards a specific bony landmark on the skull, the mastoid notch.
Caution here too.
Big one. Jugular vein. Again, anatomy is key. And in notes, you can needle either the front or back part of the muscle, depending on where the issue is.
Okay, that's a lot for the head and neck. Moving down to neck and shoulder. Upper trapezius, big one.
Huge one. Involved in head-neck movements, accessory nerve controls it. C3, C4 nerve roots too. Trigger point often near GB21, Jianjing, or shoulder well.
Neatly.
Can be done prone or side lying. Usually involves pinching the muscle and needling perpendicularly, either front to back or back to front. Adaptable based on the person.
Okay, levator scapulae.
Right.
Lifts the shoulder blade.
Right. Trigger points can be high up near SI16 Tianzhuang Heavenly Window or lower down near SI15 Jianzhong Shu. Middle shoulder.
And a serious warning here.
Very serious. Pneumothorax risk collapsed lung, especially when needling that lower point near the ribs.
Wow.
So the needle angle has to be very precise, especially for the upper part, angled posterior and medial. That caution is pure Western anatomical safety.
Sternocleidomastoid, SCM. The big neck muscle on the side.
Yep, accessory nerve again, C2, C3 roots, near ST9 acupoint. Technique involves pinching the muscle firmly
Why pinch?
to lift it away from the underlying structures, especially the carotid artery. The needle goes in obliquely downwards into the muscle belly. Big caution about that carotid artery.
Okay, that makes sense. Splenius capitis, back of the neck.
Involved in extending and rotating the head near the TB16 acupoint area. Needled side lying, aiming towards the mastoid process.
And its neighbor, splenius cervici.
Also neck extension and rotation, below the BL10 area. Needled side lying, again with pincer palpation, needle angled medially, anterior to posterior.
Semispinalis capitis and cervicis, also back there.
Yep, deeper muscles for neck movement, needled side lying, pinch grasp, perpendicular insertion from front to back.
Suboccipitals, right at the base of the skull.
Very common headache source, below BL10 area. Needled side lying, very specific angle between C1 and C2 vertebrae, aiming towards the patient's opposite eye medially.
That sounds incredibly precise.
Has to be, working very close to important structures.
Cervical multifide, stabilizers.
Yes, near the Huatua GAG, points along the spine. Needled prone, usually for deep joint pain in the neck.
And cautions.
Major cautions. Avoid the epidural space, subarachnoid space, the spinal cord itself. Needle angle is lateral to medial. Requires deep anatomical knowledge.
Absolutely. Last one for the neck scalenes. Side muscles.
Involved in side bending. Near the KD27 area, just above the collarbone, needled supine, perpendicular insertion.
But there's a catch.
Yes. Avoid the posterior part too close to the lung apex. Use a short needle, angle it posterior and superior away from the lung. Another critical safety point based on anatomy.
Wow. Okay, so that's just the head, neck, and upper shoulder area. And you said the source goes through the whole body like this.
Pretty much shoulder, arm, hand, trunk, hip, pelvis, thigh, leg, foot. It's incredibly detailed.
Yeah, for each muscle.
Same pattern. Describes the muscle's action, notes any nearby acupuncture points, but emphasizes the target as the muscle or trigger point, and lists crucial cautions, nerves, blood vessels, organs like the lungs or kidneys, depending on the area.
So examples like supraspinatus in the shoulder near LI16, caution about the lung. Infraspinatus near SI11.
Exactly. Teres minor near SI9, subscapularis access through the armpit near GB22, deltoid near several points, pectoralis muscles near lung points, caution ribs, neurovascular bundles, breast tissue, latissimus dorsi, biceps, triceps.
All with specific anatomical targets and safety warnings based on Western knowledge.
Precisely. It goes through forearm muscles like brachioradialis near LI10, wrist extensors along LITB meridians, flexors along PC channel, thumb muscles near LULI points, hand intrinsics, always linking to anatomy and function.
And the trunk muscles too, like the rhomboids, erector spinae, abs.
Yep. Rhomboids near BL points, caution pneumothorax, serratus muscles, caution lung, erector spinae along the bladder channel areas, multifidus near water Jauge points, again, caution lung or spinal cord, depending on level. Quadricetus lumborum near BL points, avoid kidney, abs near Ren, kidney, stomach channel points, caution abdominal cavity, obliques too.
Hip and pelvis.
Gluteals near GB points and others, big caution sciatic nerve, tensor fascia latae, obturator muscles near BLGB points, caution pudendal canal, sciatic nerve, pelvic floor muscles near Ren 1, Huiyin, caution nerves vessels,
Thigh muscles. Quads, hamstrings, adductors.
adductors near spleen liver points, caution femoral artery, quads near stomach spleen gallbladder channel areas, avoid femoral artery, hamstrings near bladder liver kidney channel areas, caution sciatic nerve, sartorius needled tangentially to avoid femoral vessels nerve.
And all the way down to the leg and foot.
All the way. Papilladius behind the knee near SP9, avoid saphenous nerve, calf muscles like gastroc and soleus near BLSP points, caution sciatic tibia peroneal nerves, anterior compartment muscles like tibialis anterior near ST points, caution deep peroneal nerve, lateral compartment near GB points, caution peroneal nerve, intrinsic foot muscles near kidney, bladder, spleen, liver channel points, and extra points, caution plantar nerves.
Okay, I get the picture. It's an exhaustive anatomical map guiding the needling.
That's exactly the impression the source gives. This comprehensive list really drives home its core argument. Dry needling operates within a detailed framework of Western anatomy and musculoskeletal function. The diagnosis and treatment are based on that specific understanding.
So let's boil it down then. According to this source, the big takeaway is dry needling might sometimes place needles near acupoints, but it's not acupuncture.
Right.
It's a distinct method using Western anatomical knowledge to locate and treat muscular trigger points. The palpation, the insertion techniques, the safety rules, they all stem from that anatomical understanding.
Precisely. The source stresses that even when acknowledging things like muscle sinew regions from Chinese medicine, the entire operational framework, why you needle a spot, how you needle it, what you're trying to achieve, is based on Western concepts of muscle attachments, actions, nerves, and trigger point referral patterns.
So the main message for you listening, based on this source, is that dry needling isn't just acupuncture with a different name. It's presented here as its own thing, with its own logic, its own methods, even if the geography sometimes overlaps.
Yeah, it's crucial to grasp that difference in intent. A dry needling practitioner putting a needle near, say, GB21, is thinking about releasing the upper trapezius trigger point causing shoulder pain.
Right.
An acupuncturist using GB21 might be thinking about descending chi, relaxing sinews, or affecting the gallbladder meridian for broader energetic reasons. Same spot, potentially very different reasons and expected outcomes based on the system.
And the source makes a good practical point, too, if you're curious about either of these.
Talk to licensed practitioners of both. That's really the best way. They can explain their approach in detail and help you figure out what might suit your specific situation.
Definitely. So this deep dive really highlights how two practices using similar tools, needles, can be guided by fundamentally different maps of the body. Western anatomy versus traditional Chinese medicine's meridian theory.
Exactly. Different ways of understanding, different ways of intervening.
Which leaves us with a final thought for you to chew on. Given that dry needling and acupuncture both use needles for pain relief but come from such different places, what other practices out there might look similar on the surface but actually have fundamentally different roots and ways of working that could be really interesting to unpack further?